Hey, it's Dr. Greg Olsen here at Olsen Integrative Health, your brain and nervous system specialist, coming to you with some discussions about my favorite things for the brain. So this one is the discussion about my favorite tests for the brain. So again, there's a lot of different things that have an impact with regard to the brain, but most directly, and I say this, the number one test I would do would be the Spec Scan, single photon emitted computed tomography, that gives a image of what the metabolic activity is in the brain. So if we have the structure here, we can see different places in the brain if it is actually not metabolically active, which would represent damage. So second test for me is what's called a stress response evaluation. Now, this is like a stress EEG. So we can see what state the brain is in and how it's controlling basically the stress response, and very importantly, how it is regulating the capillaries or the circulation. So there's many times in these conversations where there's the discussion about circulation, and you can only imagine that if a muscle or your brain, some part of your body doesn't have adequate circulation, then very simply, it's not going to perform well, it's going to atrophy, it's going to shrink, it's not going to be able to recall memories. There's just a whole host of things when you talk about this related to the brain. So the control factor for circulation, or the small capillaries, a huge factor related to that is the stress response. And so this really gives us a very diagnostic, the most unique diagnostic way of assessing that. And then the last one that I would look at is a blood test. It's called a NeuroZoomer Plus. Now, this NeuroZoomer Plus, what it does is it tells us what's happening brain-wise, and is there inflammation happening? Is there autoimmunity happening? Meaning that is your body attacking your own brain tissue? Is there, we'll call it leaky brain or compromise of the blood-brain barrier? So that is much like the protective barrier for the gut or leaky gut, but that is going to be the protective barrier that keeps for some substances that are damaging to the brain from getting in. That is my trio that I think is beautiful, and if I could have that for everybody that walked in the door and recommend it, I would, absolutely. So my favorite tests: Spec Scan, Stress Response, and NeuroZoomer Plus. Questions with regard to those? Let me know. Take care.